everybody. My name is Dr. Naga Srinivas. I'm the Director of Cardiology, Medical Hospital, Whitefield, Bangalore. And this is my colleague, Dr. Purnima. She is an anesthesiologist who attended this case. A brief introduction about the procedure. Procedure is called Tavi. That is, it's a transcatheter aortic valve implantation. Previously, we used to do this kind of procedures by open heart surgeries. We used to open the chest and then implant the valve. We will replace that old valve and remove the old valve and replace it with a new valve. But the problem with this open procedure is it carries some amount of risk, like the post-operative complications, the recovery, rehabilitation, etc., etc. So with the advent of this procedure, this Tavi procedure, all these complications can be mitigated. So this Tavi procedure is not a new procedure. It has been there in the world for the past 10 years, and nowadays it is picking up very fast in our country, like in developing countries like India. And the main indication for this Tavi procedure is elderly individuals, like how we have our patient, Sri Sundaram Garu, who presented to us with a sudden onset of severe breathlessness to the emergency department. And on initial examination, we found that the lungs were flooded with water. And when we did an echocardiogram revealed a critical aortic stenosis, which has been there for a long time for him, and in which he was not aware of it. So we immediately treated the condition medically. And then we did an angiogram. Angiogram showed normal arteries, and then we thought he is the right candidate for the procedure called as a Tavi, in view of his age and comorbidities like obstructive airway disease, etc. So he was scheduled for the Tavi procedure, and which was conducted with 100% success. And post procedure, he developed a transient heart block. That is, the heart rate got slowed, which we expected before also. Before the procedure also, we expected he is likely to develop a complete heart block, and based on the CT angiographic findings and his ECG findings. So the same procedure was conducted on the next day of the Tavi procedure, which was also successful. And after 1 day of stay in the hospital, he was rehabilitated and he was discharged successfully at home. And this is 2 weeks post-discharge. He is doing very well at home. And that is the story of this case. I thank the management of Medicover Hospital and my team, particularly Purnima, who was very instrumental in maintaining the general anesthesia throughout the procedure, both during the Tavi procedure and the pacemaker procedure, and successfully extubating him after the procedure. Dr. Anant Raman, who is the proctor for this case, who gave the backup for this case. These are the valve diseases. These valve diseases, the incidence or the prevalence of the valve diseases will increase as the age is advancing. This is the disease of the advanced age. People who are surviving beyond the age of 65, 70, 80, nowadays the survival rates of the individuals, the general population is increasing. We are dealing with the individuals around the age of 80 years, 90 years, 100 years also. So this is a disease of aging. And the particular challenge with dealing with these diseased elderly individuals who are very frail, they cannot sustain long procedures. The very invasive kind of procedures like open heart surgeries, open chest procedures, valve replacements, etc., etc., which are very suitable for the younger individuals. And for this kind of people, they require a minimally invasive procedure with a maximum benefit. So in this category, the transcatheter aortic valve replacement is the procedure of choice for this kind of individuals. We can also do the open heart surgery, but the open heart surgery carries a very high risk. The recovery is very rare and the complications are very, very high. So that's the reason why we chosen this safest minimally invasive or minimalist invasive kind of procedure called Tavi. So this is a disease of aging, mainly the aging process.
Preventive measures.
So the preventive measures, particularly for the aortic valve diseases, there is nothing like a preventive measures. It happens. But in general, if you ask me the prevention of the heart attacks and other things, the main thing is you should have awareness. Like there are certain risk factors for the development of the heart diseases, particularly hypertension, diabetes mellitus, high cholesterol, and physical inactivity. Nowadays, the most important or the most common factor which is responsible for the heart attacks in the younger population is uncontrolled mild hypertension. You do not have a high blood pressure of 180 or 110, but even a blood pressure of 140 by 90, if you leave it like that for a long period of time, then it results in development of some blockages in the heart. So anybody who is above the age of 35, they should undergo frequent health checkups. So thereby you can know what are your numbers and appropriately control the disease. Most of the heart diseases, they can be controlled with the proper lifestyle changes. Instead of taking the treatment, I prefer to give a preventive kind of measures rather than doing this kind of procedures. So, for example, we are focusing on the nutrition, diet, exercise, and then control of the risk factors like diabetes, hypertension, high cholesterol. If we do all these things, then significantly we can reduce the incidence of the heart disease.
ನಮಸ್ಕಾರ, ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ಪೂರ್ಣಿಮಾ. ನಾನು ಮೆಡಿಕವರ್ ಹಾಸ್ಪಿಟಲಲ್ಲಿ ಅನಸ್ಥೀಷಿಯಾ ಡಾಕ್ಟರ್. ಸೊ ಈ ಒಂದು ಪ್ರೊಸೀಜರ್ ಟಾವಿ ಅನ್ನೋದು ನಾಟ್ ವೆರಿ ಕಾಮನ್ ಹೇಳಬೇಕಂದ್ರೆ. ಅನಸ್ಥೀಷಿಯಾ ಜೊತೆ ಕಾರ್ಡಿಯೋಲಜಿಸ್ಟ್ ಜೊತೆ ಮಾಡುವಾಗ ನೀಡಲ್ ಕ್ಯಾಥೆಟರ್ ಪ್ರೊಸೀಜರ್ ಅಂತ ಏನು ಹೇಳ್ತಾರೆ. ಸೊ ಇಟ್ ವಾಸ್ ಒನ್ ಆಫ್ ವೆರಿ ಗುಡ್ ಆಪರ್ಚುನಿಟೀಸ್ ನಮಗೂ ಕೂಡ ಈ ಪ್ರೊಸೀಜರ್ ಜೊತೆ ಡಾಕ್ಟರ್ ನಾಗ ಶ್ರೀನಿವಾಸ್ ಜೊತೆ ಮಾಡಲಿಕ್ಕೆ. ವೆರಿ ವೆಲ್ ಡನ್ ಪ್ರೊಸೀಜರ್, ವೆರಿ ಮೆಟಿಕ್ಯುಲಸ್ಲಿ ಡನ್ ಪ್ರೊಸೀಜರ್ ಇದು. ಪೇಷಂಟ್ ಕೂಡ ತುಂಬ ಕೋಆಪ್ರೇಟ್ ಮಾಡಿದರು ಈ ಎಂಟೈರ್ ಪ್ರೊಸೀಜರ್ಗೆ. ವೆರಿ ಸಕ್ಸಸ್ಫುಲ್ ಆಯಿತು, ತುಂಬ ಸ್ಮೂತಾಗೇ ಆಯಿತು ಪ್ರೊಸೀಜರ್. ಎಲೆಕ್ಟಿವ್ಲಿ ನಾವು ಪ್ರೊಸೀಜರ್ಗೆ ಜನರಲ್ ಅನಸ್ಥೀಷಿಯಾ ಅಂತ ಪ್ಲ್ಯಾನ್ ಮಾಡಿ, ಸೊ ಎಂಟೈರ್ ಪ್ರೊಸೀಜರ್ನ ಪೇಷಂಟ್ ಕಂಫರ್ಟಬಲ್ ಆಗಿದ್ದರು. ಪೇಷಂಟ್ ಪ್ರೊಸೀಜರ್ ಕೂಡ ತುಂಬ ಚೆನ್ನಾಗಿ ನಡೀತು. ಪೋಸ್ಟ್ ಪ್ರೊಸೀಜರ್ ಕೂಡ ಪೇಷಂಟ್ ರಿಕವರಿ ಆಲ್ಸೋ ವಾಸ್ ವೆರಿ ಗುಡ್. ಸೊ ನಮಗೂ ಕೂಡ ವಿ ವರ್ ವೆರಿ ಥ್ಯಾಂಕ್ಫುಲ್ ಟು ದ ಎಂಟೈರ್ ಟೀಮ್ ಆಫ್ ಮೆಡಿಕವರ್ ಆ್ಯಂಡ್ ಟು ಡಾಕ್ಟರ್ ನಾಗ ಶ್ರೀನಿವಾಸ್ ಸರ್ ನಮಗೆ ಈ ಆಪರ್ಚುನಿಟಿ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ. ವಿ ಆರ್ ವೆರಿ ಗ್ಲ್ಯಾಡ್ ದಟ್ ಪೇಷಂಟ್ ಕೂಡ ಪೋಸ್ಟ್ ಪ್ರೊಸೀಜರ್ ತುಂಬ ಚೆನ್ನಾಗಿದ್ದಾರೆ.